Hi, everyone. I'm Andrea. I'm the Program Director of SCAN, and welcome to SCAN FYI.
Good morning, everyone. I'm Marybeth Kwapniewski. I'm the Program Coordinator, and we're happy to have join with us this morning Tony Colon of Coral Harbor Rehab. Good morning, Tony.
Good morning,
Good morning,
Tony.
everyone. Thank you
How
for
are
having me.
you?
I'm doing well. Thanks for having me today.
Thank you. Thank you. So, Tony, we like to have our guests tell us, to have them tell us a little bit about themselves. So I'll give you that opportunity.
Sure. So my name is Tony Colon. I'm a nurse by trade. I've been a nurse for over 24 years. I started my career in Kessler Rehab, and then I moved down to Ocean County, New Jersey, back in 1999. And I started working for a small company called Rivera. And they grew, and then it became Genesis. And I recently joined the team with Coral Harbor about a month ago. So I've worked with many different corporations doing long-term care, subacute rehab, and that's what we're here to talk about today.
Wonderful. So, Tony, yes, today we're going to talk about subacute rehab. So I think the first thing you should probably do is just tell everyone exactly what subacute rehab is all about.
Absolutely. So subacute rehab refers to the level of care that a patient will need. So when a patient goes to the hospital, it's considered acute care. And then right under that, there's acute rehab. And then there's subacute rehab where we work, where we operate at. So in a subacute center, which is also called a SNF, skilled nursing facility, we have a 24-hour nursing staff, nurses, caregivers. We have doctors coming to the building. We have physical therapy, occupational therapy, and speech therapy, and they're all there to meet the client's needs and help them to discharge back to the community. So if someone has some kind of medical issue or an accident of some sort, and their prior level of function, how they do things normally, their independence level, if that's any way impaired, hospitals will oftentimes refer people to subacute for subacute care for rehab. So that's where we come in. I work for Coral Harbor, and we do subacute rehab. We also have long-term care. So our goal is to get people back home, into the community, and that's what basically subacute is all about.
So, you know what? First of all, we have to give Marybeth a big shout out to Coral Harbor, because they have been a fantastic supporter of SCAN for many, many years. And so it's been, really a pleasure for us to work with them. So yes. It's great to finally meet you, because your predecessor, Pam Montemerno, she was just the best. And
awesome.
So, we have really good feelings about Coral Harbor.
Awesome. Yeah. So Pam is still with us. She's taking a regional role. And Coral Harbor and Marquee, our parent company, we're very much into, engaging the community and being active with, all sorts of community events. And Pam was like, I'm part of SCAN. You make sure you stay up with that.
Yes.
So we will be working together.
Good. We look forward to that. So who are the people that typically qualify to come to a subacute rehab care like Coral Harbor?
So typically people get to the hospital and, they have an accident or they're sick and they decompensate. So anytime where any of their daily activities are impaired, where you can't get your shoes on, for example, you used to be able to get dressed. Now all of a sudden you injured your back, you can't get your shoes on. That type of person might be able to go to subacute care. Most of the time we see it in seniors. They go to the hospital for a couple of days, they decompensate, they get weak really quick. Somebody gets the flu, somebody, maybe they lost a little bit of blood and they've been sitting in the hospital bed for a couple of days. They get very weak and they can't walk safely. They can't do their daily care safely. That person would be eligible to come to subacute care. And, sometimes they also have other issues like cardiac issues or lung issues, maybe some renal issues. And those things impact the overall health. And those people would qualify for subacute care.
You know what, Tony, why don't you give a plug right now to remind people about their flu shots?
Yeah, absolutely. Flu season is here. And, we're going through this COVID pandemic and, there's no sense of getting the flu at the same time. So go get your flu shot.
Right. Right.
So
Yeah.
speaking of COVID, which I'm sure we probably, are trying to avoid talking about
You
it, but
can't.
unfortunately we can't.
Absolutely.
How does Coral Harbor and its other facilities manage that environment? And hopefully we won't see a severe second wave, but we need to be prepared. And how is Coral preparing?
Absolutely. So that seems to be the hot topic right now. Everybody's talking about COVID. Everybody's scared. There's a lot of people, they're not in the medical industry. They don't know, and you're scared of what you don't know. But the media has given subacute centers specifically a bad rep, and I don't know what other states are doing, but New Jersey, they took steps and they implemented a lot of new regulations that we had to put in place to make sure that everybody's safe. So one of the first things they did was they asked every subacute center to put a plan into place, how we're going to quarantine new people coming in, how we're going to quarantine people that have COVID, how are we going to keep our existing population safe. So we had to put this huge plan into place. We had to submit it to the state, actually, and then they had to come in to every center to verify that we're doing what we said we're going to do. So they came into Coral Harbor twice. We were deficiency free. That means we did everything on our plan. Also, the state immediately, they stopped visitation, so visitors weren't allowed to come in. A lot of family members were upset about it, but they understood the need. So we don't want to infect the people that live there for a long-term population, and the subacute people that are coming in for rehab. We don't want them to be infected at all. So families understood. We had to address that. We started doing Zoom conferences with families, and once the patients there they're tested for COVID, and once we determine that they're negative, they don't have it, they're able to schedule outdoor visits with their family. Anyone that comes to the center, they have to be screened coming in. We check their temperature. There's a health assessment that we do for them coming into the building, and we're not allowing just anybody to come into the center. It's mostly practitioners, doctors, nurse practitioners, anyone providing a service for our clients. Those are the people that are allowed to come into the center right now. The staff is being tested every week. The patients that live there, long-term patients, they don't get tested every week. They get tested once a month. But once it's determined that they're negative, they're not carrying COVID, they're considered okay. So they're allowed to go out of the room, ambulate, go down to the rehab. They have to keep social distancing, obviously, and they have to wear a mask in the hallways. Staff has to wear PPE all day long. They got to wear a mask as soon as they walk in the building, and as they're going into the rooms, they have to gown up. And the new patients that are coming in, we screen them beforehand. If they're coming from the hospital, we ask that they have a COVID swab there in the hospital to make sure that they're negative. And then they go on our isolation. It's not isolation, it's quarantine unit, where they're quarantined for 14 days, just to make sure they're not having any symptoms, that COVID doesn't pop up. So we've been very cognizant of infection control and cross-contamination. The staff that works on the quarantine unit, they're not allowed to work anywhere else in the building, so that, if something happens on that quarantine unit, there's a breakout.
It stays,
it's contained.
Exactly, it's contained.
Right.
So we very much have put a lot of policies and a lot of things into place to prevent the spread of COVID. And Coral Harbor, fortunately, has been not affected at all. We had taken a patient that went to the hospital, and it was our long-term patient. They were infected with COVID, but they didn't have any symptoms. They were isolated and they recovered. So we have no COVID, and actually we're entering into our second stage, meaning that they're going to start allowing other vendors and some visitors into the building.
So even now, people coming into Coral Harbor from, let's say, Monmouth Medical Center or Jersey Shore, even now people would be isolated, correct?
Yes, they're quarantined for 14 days. And then
quarantined, isolated is a terrible word.
Yeah,
But I guess
because we do cohort them as they come in. We cohort them as considered first in, first out rules. So whoever's there the longest, we'll put them bunk them together because we have semi-private rooms. So
Right.
they'll go together because they're not showing any symptoms. And the newer person will go into a room by themselves. If there's two new people coming in the same day, they'll go in the same room.
Together.
And then they get monitored. We do screenings every day. They check their temperatures, vital signs. We're checking to see if there's any kind of symptoms. And we go from there. The way we have our centers are set up, Coral Harbor was a negative building, so we didn't have any COVID in the building. And then we had our sister centers, Willow Springs, which they had a COVID unit just for COVID patients, and it was totally separated from the rest of the building. And then we have our other building in Freehold, which was a COVID center, the Jewish home. They actually have 3 floors, and the top floor was their COVID positive unit. So if we were getting new cases that were COVID positive, we were sending them to the appropriate centers.
It's a
So I
lot of
think
coordination going on.
Yeah, absolutely.
A tremendous amount of effort happening behind the scenes.
Yeah.
Yes.
So I think
absolutely.
it's fair to say that if someone is in need of rehab for yourself or a family member, that you should feel very confident going
Confident.
to a place like Coral Harbor,
Yeah, absolutely.
knowing everything that you've put into place.
Yes. And there's so many more things that are going on behind the scenes just to prepare to make sure that everyone that's coming in is COVID free, and where we have the adequate staff and PPE and all that stuff that we need. So
And
it
Tony,
has impacted us.
I'm going to assume that when someone is in quarantine, then their physical therapy is happening in their rooms until
Yes.
they're cleared, right? Okay.
Yeah, absolutely. They're having their therapy in the rooms until they're done with their 14 days, and then they'll come down to the gym.
Like Marybeth, we were saying before, we don't like to talk about this every single week, but unfortunately, you can't avoid talking about COVID.
Absolutely.
And you have to give the folks out there that are listening to this that level of security and safety so that they know that it is okay to, go to, if you need a rehab place, you need to feel confident, right?
Right,
Yeah,
exactly.
absolutely.
Yeah.
We see that a lot right now. People that need rehab, they're just going home because they're scared and they don't know. So this is great that we're able to do this.
I totally get that, actually, but on the other hand, there's certain things that you just, if you can't
wanna be
manage at home, you need to be in a better place. That's
You
for
want to make
sure.
sure you make that transition back home in a safe fashion.
Mhm.
So that's
And another thing that, we've talked about here as well, when you're in the hospital and they tell you that you have to go to a rehab, if you haven't done your research
Yes, I
and
was
know
gonna say
what's
that.
out there, what places are available, you might wind up going where the hospital wants to send you, not where you want to go. So how can people, be prepared? Can they come take a tour? Can they see your facility?
So right now we're not
Well,
doing
maybe not right
in-house
now.
tours. But generally what I like to tell people is, you want to be ready. Just like when you're saving up for retirement and stuff, you don't wait till the last minute. You want to do a little bit of research beforehand, especially if, you have some comorbidities, you have some illnesses, you have some stuff going on with you. Somebody that has heart issues, you never know. You could decompensate pretty quickly, and you don't want to wait until the last minute when you're in crisis mode to figure out where am I going to go. The hospital is going to steer you where they want to steer you, or whoever has beds. But if you know ahead of time, then and you are able to make an educated choice, your outcomes are going to be a little bit different. So I would recommend to people that they go online. The Center for Medicare Services, they have their own website, cms.gov. They give the ratings based on regions. So
I'm writing that down myself.
Yeah, cms.gov.
cms.gov.
So you could actually go on there and you can check out Coral Harbor. We're actually 4 stars out of 5. 5 stars being the best. And there's a couple breakdowns.
That's nice.
Yeah, there's a couple breakdowns that you go from state survey, which they come in every year, and they stay for a week to make sure that you're following your policies and everything that you say is going on is actually happening. So you'll see the star rating for that, and that's 4 out of 5 stars also. And then the next one is staffing levels, which the state gives us like state minimums on what kind of staffing we would have based upon the level of care people need. It's like this whole scientific equation. But there's star ratings for that. And then there's star rating for quality measures, which is actually very important. People don't know what it is, but it goes on all the assessments that we have to do, the care that we have to do. Everything is documented every day on every single patient. So those quality measures, they change from quarter to quarter, depending on what we're reporting to the state. And those quality measures, they're also rated on there by stars, 5 stars being the best. So that means, you know, you see a 5-star on there, they're doing everything they're supposed to be doing for the patients. Coral Harbor, like I said, we have 4 out of 5 stars, which is pretty good.
Excellent.
We're due for survey any day now. I'm hoping we get 5 stars. But do that kind of research. You also want to go to a center that's going to meet your needs. Not every center does everything exactly the same. Every SNF is going to have a rehab team. We have a rehab team. They're there 7 days a week. Some places don't have rehab 7 days a week. They only do Monday to Friday.
Right.
Also, too, if you have any like cardiac issues, pulmonary issues, or if you're on PD dialysis, that would be something you would want to look into also. You want to make sure that that specific place is able to take care of those things. Coral Harbor is able to handle all 3 of those things. We work with some of the top docs in Monmouth County, and they come to our building once a week to monitor those kind of patients. So if somebody comes to us, they broke a hip, but they also have CHF, we're able to get our cardiologists to come in there, see them, make sure that they're on the right meds, make sure that they're not decompensating, that they're progressing toward going home. So
One
that's
of the
very
things
important.
that I'll say that I've learned from working at SCAN actually is, and meeting lots of subacute rehab representatives, is that they're not all created equal. And I didn't realize that many of them, like Coral Harbor, have some subspecialties right within there, such as the kidney specialty that you offer. So that is a super important thing. If you're doing research for where would be a good place to go, you need to factor that in, because not everyone offers everything. That's a really important point to remember.
Yeah, absolutely. And Marquee is very much, they want to be innovators. They want to stay above, ahead of the needs of the population. So if, you know, we see a need out there, we're trying to address it. You know, I just came on board a month ago. I see a couple things that, you know, a couple programs that I think we're going to start up in Coral Harbor also, but they do have a core set of specialties, which is awesome. You know, they have cardiology coming in, they have pulmonology, they have a renal program, which we're able to do PD dialysis, which not everybody does. So we're able to handle a multitude of diagnoses at Coral Harbor. And it's important to know where you need to go beforehand. You don't want to wait until you're in the hospital and, you know, you need PD dialysis and now they're trying to send you somewhere that doesn't do it. And what are you supposed to do? You need this every day, you know, so.
Well, unfortunately, with most human beings, we don't take action until something happens, whether it be for us or a family member. So yeah, once again, I have to say, you really need to do some research and see what's going to be the best place for you. I will remind you all, I will put links for Coral Harbor and the Medicare, cms.gov. I'll put all of that in the comments so that if anyone wants to do a little research, you can definitely do that. By the way, unsolicited testimonial. Coral Harbor has done many community event programs, and I've had the good fortune to go there many times. And you know, it's just a beautiful place. There's nothing, well, this is pre-COVID, let me say that, BC. It's a beautiful place. There's nothing institutional looking about it. You would never think you're in a rehab place. I mean, they've made it very, very beautiful, very comfortable. So you feel good when you're in a place like that. The rooms were beautiful. I was very impressed with everything that I saw. So I wouldn't hesitate to recommend it to anyone. It's beautiful.
Thank you. Thank you. Yeah, we try to make everything look as nice as possible and make people as comfortable as possible coming in for rehab, you know, because it makes a difference. You know,
of course, you know, psychologically, you want to be in a place that feels good, that looks good. Yeah, not super depressing. So I think you've exceeded people's expectations of what's the possibilities.
I think some people, you know, they still have the image of one flew over the cuckoo's nest for these kind of like centers, and you know,
Nurse Ratched.
And Marquee's really, you know, they stepped up their game, and you know, they want to make this place nice and successful for people. You know, they come in, they're comfortable, and they're able to focus on their rehab and get back home.
All right. Well, Tony, thank you very much for being with us today. I hope everyone has learned a lot, not just about Coral Harbor, but about subacute rehab in general, and that you will do your research. So in case you ever need the service, you will be prepared and you will get exactly what you want.
Absolutely. And if anybody ever has any questions, they could just feel free to email me. I'm also like the nurse liaison navigator, so I can help people transition wherever they need to go.
You have a long title.
Yeah,
You have a lot of stuff
a lot of
there.
hats,
Yeah,
but you know, the overall goal is to
it's good.
help the community.
Okay. Well, remember everyone, if it's important to you, it's important to us. I'm Andrea Tarr, and we will see you next time on Scan FYI. Bye, Mary
Good day,
Beth.
everyone.